Hi and welcome to ABC Vascular Ultrasound video case superficial femoral artery chronic occlusion with developed collateral pathway. We start the assessment using color flow imaging at the level of the common femoral artery using a longitudinal view. We can see here the common femoral artery dividing into the profound femoral artery and superficial femoral artery. We focus the attention on the superficial femoral artery. As anatomical landmark, we have the superficial femoral vein underneath the superficial femoral artery. We can see that there is a normal appearance of color flow of the superficial femoral artery. We move the transducer along the superficial femoral artery. We are approaching the mid-thigh where the superficial femoral artery appears to have a reduced color filling until to the point where color is not represented within the lumen of the superficial femoral artery. We're going to assess this region more carefully, as this might be the region of occlusion of the superficial femoral artery. If we zoom on this region, we can actually note the presence of aliasing at this level, and beyond this region there is no color filling the lumen of the superficial femoral artery. We can note that we have a very low scale and there is no color filling. We can see echogenic material within the lumen of the superficial femoral artery, and these are generally criteria to indicate the presence of an occlusion. Beyond the region of occlusion, we can see that there is again aliasing and there is flow reforming in the distal region of the superficial femoral artery. If we assess the region of aliasing, we can note that this is actually a collateral, which is bringing flow into the superficial femoral artery and is feeding the distal region of the superficial femoral artery. Collaterals are represented with aliasing and can mimic the presence of stenosis. As per the occlusion, we classify this occlusion as chronic, first of all, based on the clinical presentation of the patient, the echogenicity. There is a bright echogenicity. The thrombus is well organized and is occupying the entire space of the lumen, and also there is the presence of collaterals. The clinical presentation is the most important criteria to classify the occlusion. Ultrasound criteria are adjunctive to the diagnosis of an acute or chronic occlusion. In this video, you can see the difference in appearance of a chronic and acute occlusion. In the acute occlusion, the echogenicity is less represented than the chronic occlusion. The thrombus is actually mobile, and you can see that there is an end part of this thrombus that is actually fluctuating within the lumen. Also, the patient presented to A&E with evidence of acute ischemic limp. If we assess the flow distally to the region of occlusion at the level of the posterior tibial artery and anterior tibial artery, we can sample monophasic low velocity flow, which is another criteria used to diagnose the presence of an occlusion. And we can see in this diagram that the occlusion is in the mid-thigh region, and distally there are two vessel runoff. The peroneal artery was not visualized in this case. In conclusion, there are direct and indirect criteria to determine the presence of an occlusion. Absence of color flow within the arterial lumen using a low color flow scale and direct visualization of thrombus represent direct criteria. The presence of monophasic or damped low velocity flow beyond the region of occlusion are indirect criteria and are suggestive of the presence of a proximal occlusion. To stage the occlusion, we can use ultrasound criteria as echogenicity of the arterial thrombus, the location of the arterial thrombus, and the presence of collaterals. However, to determine the age of thrombus, we should correlate these ultrasound criteria to the clinical presentation of the patient, as this is the key element for the diagnosis. Thanks for watching ABC Vascular Ultrasound.